Maintaining safe, caring environments. Safety is the number one aspect of any uh, nursing content area. We want to provide safe and culturally competent, patient-centered care. And so objectives here will be that you learn to apply the nursing process to individuals who are experiencing safety alterations, people who are at risk, incorporate safety across the lifespan, demonstrate effective body mechanics, determine how the correct identification of patients, applying OSHA and OVA regulations, and choose measures to minimize use of restraints whenever possible. So the NCLEX, the purpose of the NCLEX is to protect, to teach, of the license exam is to protect the public. A major portion of the NCLEX to pick the intervention or priority that keeps the patient safe. So throughout your career, particularly PN, we're teaching you how to provide and perform safe care. So safety is a fundamental concern of nurses in preventing injuries and assisting the injured. You need to be aware of what constitutes, what creates a safe environment. Factors affecting safety involve any area, whether it be the environment, medications, mobility, vital signs, what you do and do not report to the physician, is maintaining good skin care. It's every aspect of nursing. Factors affecting safety are the age. Children don't always have the knowledge or experience to know what's safe or unsafe. You should know the major risk factors for each group. For infants, being suffocation, young children, aspiration, poisoning, and trauma. For your older adults, they're at risk for the postural changes, slower movements, putting them at increased risk for falls and skin breakdown. Factors affecting safety, again, we've already talked about mobility and infection. Review again, mobility and health status affects safety. Loss of balance, coordination, use of assistive devices, loss of movement, dizziness, tremors, all affect safety. So just reviewing back, hypotension, contractures, strokes, illnesses like Parkinson's, again, affect mobility and the health status. Clients weakened by illness or surgery are not always fully aware of their condition, so we have to protect them. We're protecting them from the environment and protecting them from themselves. Factors that can also affect safety have to do with sensory perception and awareness. Again, neurological impairment. This goes back to what we discussed in the section on activity. We're assessing, we're looking at the factors. Touch, are there any neurological impairments to touch, to hearing, to taste, to smell? Do they have a decreased cognitive awareness? Is it because of medication, stroke? Do they have impaired judgment? Are they in an unsafe emotional state, such as a person who wants to hurt themselves? They don't feel they can live anymore. So you're looking at the sensory perceptual awareness and the cognitive awareness, and you're assessing, is there a problem related to safety that I need to address with my good nursing care? Factors affecting safety affect the ability to communicate. A patient that cannot hear, the patient who has impaired hearing, the patient who has impaired speech, the patient who has impaired vision. This impairs the ability to communicate and then can be a safety risk. Safety awareness information is crucial to safety. So a lack of knowledge on how to utilize equipment, how to maintain their home, not to ingest poisonous substances, again, are factors affecting safety. So you're assessing your patient's ability to communicate. Do they have any sensory areas that are impaired? What are you going to do about it? Give them a hearing aid, give them an amplifier, give them a bell, give them a pen to write. What are you going to do as the nurse? And then how aware is your patient cognitively of their environment? What teaching do they need to remain safe in their home or in your facility? Factors that can affect safety can be related again to your medications, sedatives, hypnotics, antihypertensives, diuretics, and your narcotic analgesics. The elderly who will use multiple medications are at increased risk for medication toxicity and confusion. Factors affecting safety are environmental factors as well. Even in nursing assistant, you are taught how to maintain a safe environment for your patients. So you want to think about, again, review. We're coming through the same content again. Lifestyle, factors, safety, good lighting, keeping their environment and them clean, keeping things in good reach for them, accessible to them. So factors, again, relate to things we are assessing for. So we're assessing for medications that affect that affect the patient's safety. We're looking at environmental factors that can impact the patient's safety. We want to try to never use restraints. In fact, most of your facilities are restraint-free facilities. But when it comes to restraints, you must, if you need to use them, you have to document that you have tried every other measure prior to the restraint. Then, if you have to have a restraint, you need a doctor's order. That doctor's order is only for 24 hours. It must be renewed, and the patient's status and need for restraints must be reassessed every shift, and then by the physician every 24 hours. The rationale for restraints to prevent falls, wandering, or causing the patient to hurt themselves. Complications of restraint use. One reason that they're not used very often is because they put the patient at risk for impaired skin integrity, urinary retention, fecal impaction, which again increases the risk for infection, strangulation, loss of self-esteem, and they become more at risk for falls because they are in a more weakened state because they are not mobile, and then they have the impact of immobility. Legal implications of restraints have to do with the standards for the U.S. Centers for Medicare and Medicaid Services. They apply to all health organizations. Standards for restraint use have to do with behavior management. You need to evaluate the use of restraints every hour. The order must be written within 4 hours of putting the patient in restraints. And you need to be evaluating the patient on a continuous basis. When a patient's in restraint, they must be monitored every 30 minutes to an hour based on your facility policy. They can only be used after all possible means of ensuring safety have been unsuccessful and documented. And the order for restraint must include the reason and the time period. And you must document that the need for the restraint was made clear to the client and their patient. That means if you put a patient in restraint, you must let them know why, and you must contact the family, particularly if the patient is not cognitively oriented. You must, only those people trained in restraint use should put them on. If you're in a nursing home, the RN needs to co-sign the order for you, the LPN. Restraint should not restrict breathing or circulation in any manner. And here are some alternatives or interventions for restraints. Frequent observations, keeping lights on, toileting patients every 2 hours, including the patient in activities for stimulation, frequent reality orientation, having pressure-sensitive alarms, and wander guards. You want to do everything you can to keep the patient safe, but yet not restrain them. And patients are more at risk less at risk for falls and safety issues if we're properly toileting them regularly, preventing incontinence, reducing the anxiety for care. If they see you If you're checking on them often, they're less likely to feel alone and to be afraid or feel abandoned, and so they're less likely to have safety issues. So you want to be, again, cognizant of the nursing diagnoses that are related to falls and the risk factors. And again, you want to, as you assess your patient, determine what defining characteristics your patient presents, or what risk factors or defining characteristics your patients present that could lead to a need for that particular nursing diagnosis. Again, this is getting to be reviewed. It's important that you, again, maintain safety in your environment and that you document any falls per the policy in your facility, that you communicate with your colleagues, and you familiarize yourself with the OSHA requirements and Joint Commission requirements regarding safety and falls. In your syllabus, there are the National Safety Goals 2014 for long-term care in hospitals. You are going to be required to know those. That is very testable information. That is all for maintaining safety, safe care environments. Make it a great day.